Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet Dr. Andy Smith of Novant Health Surgical Associates to learn more about general surgery. Then we will welcome Dr. Stephen Nuns of Novant Health OBGYN to discuss the importance of preventive care for women. And finally, Dr. Ted Parcell of Novant Health Orthopedics and Sports Medicine will join us to share more information about his clinic and the safety measures in place to protect patients and their families. Stay tuned to learn about valuable health topics with Health Watch. First, let's welcome Dr. Andy Smith of Novant Health Surgical Associates. Well, Dr. Smith, it's a pleasure to have you back, and we had you on recently when you were talking about the Da Vinci robot. So we're real excited to have you back today, but before we dive into this, I will just reintroduce yourself and tell us a little bit about your education and your background.
Sure. Andy Smith. My first name is Joseph, so people tend to find me that way when they're looking me up on the internet.
Joseph.
Yeah, right. So anyway, but I've been with Novant Surgical Associates now for 3.5 years, coming up on 4 years, which is kind of hard to believe. It's gone by so fast.
It is hard to believe, yeah.
But anyway, and I'm a general surgeon in Brunswick County, and we cover all of Brunswick County.
And tell me a little bit about where you went to school.
Sure. I went to the University of Tennessee for both undergraduate and medical school. The medical school main campus is located in Memphis. So after spending 4 years in Knoxville, I spent 4 years in Memphis, Tennessee.
Mm-hmm. Yeah, great. Tell me, general surgery encompasses a lot. So tell me what it means to be a general surgeon.
Sure. Well, the old saying, years ago was general surgery is the skin and all of its contents. So if you thought of it that way, it was everything. Certainly things have evolved and there's more specialties and subspecialties now in medicine. But as a general surgeon, our role is really to take care of a wide variety of disorders that primarily involve skin, soft tissues, breast, gastrointestinal system, which includes the liver and the gallbladder and the pancreas, colon, and anal rectal diseases.
Wow. Jack of all trades. I'm curious, what interested you in becoming a general surgeon?
Sure, that's a great question. When I was a medical student, I liked everything. I liked the systems, the physiology, the wide variety of things, and I felt like a general surgeon was probably the most complete physician, someone who can understand the physiology and manage patients both medically and surgically, and the tangible nature of being able to fix something with surgery was certainly very appealing.
Mm-hmm. Well, there's quite a variety there too. I bet you don't get bored.
Never.
Well, let's talk about your clinic. Now I know you have several offices and you have a few partners, so let's talk about your partners.
Sure. So there's 5 of us total at Novant Surgical. There's Dr. Tillotson and Dr. DeSandre, who've probably been there the longest.
Long time. Mm-hmm.
And we won't call out years or age. and then Dr. Scallion, and then Dr. Benenati, and myself. Mm-hmm. We all certainly practice a wide variety of general surgery. Some of us have certain things we're a little more interested in than others.
Mm-hmm. Yeah, well, that makes a nice mix. You cover all the bases there. I heard you recently expanded hours and days in Leland and I think in Southport, correct?
That's correct. We have offices, of course, all over the county, locations in
Your
Leland.
main office is here in Bolivia, right?
Correct. The main office is in Bolivia by the hospital on 17. We also have offices in Leland, in Southport, and down in Carolina Shores in the Calabash office.
Mm-hmm. Now, did you expand the number of days in Leland?
Yes. So previously, I think we were covering 1 or 2 days a week in Leland, and we're expanding that now. Dr. Beninati had primarily been in the Leland office, and now
Yeah.
I'm going up there. So, as we continue to grow and patient volume continues to grow, we're, spreading out and expanding our services
You're
in all of
going
those
where
locations.
the services are needed.
That's right.
And do you find that you are increasing the number of patients in the Leland market there, and they just don't want to drive all this way, and that just makes it easier for them?
I think it certainly makes it easier for them for clinic visits, for office visits. Certainly, things they have to come to the hospital for are not nearly as frequent. So,
Right.
And I think they appreciate being able to stay a little closer to home. And of course, the Asburys have a huge office up there with Oceanside Family Medicine, and
Yeah, that's great.
and so there's a lot of patients that are out of that office, and we're right next door, so that
That's
helps.
a beautiful new office that they have. And I believe that Brunswick Surgical is now in with Novant Health OBGYN, correct? That's the space you're occupying.
That's
with
correct.
them.
Yeah, we're right there.
You share that space
in
now.
the same building. That's correct. Yeah,
Yeah. Well, that makes it convenient for the patients, for sure.
absolutely.
Now, I know that you focus on a wide variety of general surgeries. So tell me about the types of surgeries that you do personally.
Sure. So again, break it down by body system. If you talk about skin and soft tissues, we do a lot of skin procedures that can be anything from little minor lumps or bumps, what I call lumps or bumps, lipomas, skin lesions, things like that we do in the office, all the way up to skin cancers, melanomas, squamous cell carcinomas of the skin, lymph node procedures that oftentimes are tied in with those types of cancer surgeries for the skin and soft tissues. We also do a very wide variety of fully encompassing breast practice. So that includes, monitoring with imaging of breast disease, so mammograms and ultrasounds. It also includes biopsies both in the office and at the hospital, and then procedures if necessary for breast disease. Moving on to inside the body, if you think about the GI tract, so we do a full range of procedures from endoscopies, which include EGDs and colonoscopies, stomach surgery, small intestine surgery, colon surgery or large intestine surgery, and then of course anorectal diseases, which includes things as significant as cancer and things as simple as hemorrhoids, which aren't always simple, but certainly things we all take care of, completely there. So in addition to those types of things, we do hernias. So that's a very common problem for people. They form hernias either from old incisions or naturally occurring hernias. We fix all of those in a wide variety of techniques and technologies that we use. And then, of course, simple things like gallbladder surgery that most people are familiar with. We also do emergency surgery. So when something comes into the emergency room, one of us is on call, and that may be perforated ulcers, it could be diverticulitis, it could be emergency gallbladder surgery, appendectomies for appendicitis, things like that.
You touched on cancer surgeries. Tell me how you orchestrate the aftercare of that, so to speak, like oncology and radiation.
Sure. So, anytime we're talking about an oncologic procedure or a cancer diagnosis, cancer surgery, things are very well organized. There's very clear gold standard guidelines that we practice by. And so we do that in coordination with oncologists and radiation oncologists and oftentimes radiologists and pathologists. So think of it as a whole team that comes together and takes care of one diagnosis. We have a tumor board that meets frequently, and that allows us to sit down and discuss certain cases with all of those people in attendance to come up with the appropriate treatment strategy and game plan to how to manage, for how to manage each individual diagnosis. We work very closely with the Zimmer Cancer Center, which is part of New Hanover, which is now part of Novant. We also work closely with the radiation oncologist, which is also part of the New Hanover medical group. So, it's very easy coordination among all of those providers, and it's fairly seamless for the patient.
Wow. I think with the acquisition of New Hanover, it just made things more seamless. I think it's going to be a great thing for the residents of Brunswick County.
Absolutely, absolutely.
Well, I hate to tell you, but we are out of time. And I had so many more questions to ask you. Promise me you'll come back.
I will. I talk a lot, so I can use time up pretty quick. Sorry about that.
Well, that could be a good thing. Well, thank you so much for coming. We
Sure.
really appreciate it. And I look forward to seeing you again really soon.
My pleasure, June. Thank you.
Thank you. Now, let's welcome Dr. Stephen Nuns of Novant Health OBGYN. Welcome back, Dr. Nuns.
Oh, thank you. It's good to be here.
It's a pleasure to have you back on the show. What have you been doing?
Well, I've been getting settled at the practice. You know, I started back in August of last year.
Yeah.
It's been a little bit of an adjustment, but it's been fantastic. I couldn't be happier anywhere else.
Awesome. Oh, that's great to hear. Well, there may be some people out there who haven't really met you yet, so tell me a little bit about your education and your background.
Sure. So I was actually born right here in North Carolina in the Fort Bragg area.
Oh, that's right. I
And
forgot that.
Yeah, and I went to Wilmington for undergraduate school, then actually went to Greenville at the Brody School of Medicine for medical school, and then back to Wilmington for residency. And then when I completed residency, I decided to stick around close by, and now I'm here.
That's awesome. Yeah, we get a lot of residents from New Hanover. That's worked out well for us.
Pretty much every OBGYN that's there, yeah.
I know. And so you're enjoying the area so far?
Oh, yeah,
Of course, you were
absolutely.
here for your residency, so.
Yeah, but that got me very familiar with the patient population that I'm treating here, and it's a population I know very well, and I feel comfortable taking care of them.
Yeah, awesome. Well, tell me a little bit about Novant Health OBGYN.
Yeah, sure. So it's the primary OBGYN provider for Brunswick County and a lot of the surrounding areas. We've recently acquired New Hanover as well, so we're really the largest game in town. There's 8 providers. There's me, and there's 4 other physicians, 1 midwife, and 2 nurse practitioners, and we run the whole range of women's health care.
And you have several locations, right?
Yes, we do. Our primary location is in Bolivia near the hospital,
Right.
but we also have locations in Calabash and Southport. And we've recently started to increase our presence in the Leland area as well, where I'm there once a week and my partners are there usually once a week as well.
Oh, nice. And you provide both maternity and gynecologic services, is that correct?
Absolutely, and it runs a large range. So we go from, as far as obstetrical care, we have midwifery care. Our fantastic midwife, Kia Fox, provides a lot of that. Along with me and my partners, we provide more traditional OB/GYN care. And then we have advanced GYN solutions with the Da Vinci robotic system, which can range from normal routine care versus more advanced surgical options.
Yeah. Well, I know that people in the community, women, have been putting off some of their yearly checkups and what have you due to COVID. So is this something that you're noticing in your care for your patients? Have they been putting off their treatments?
Absolutely, and understandably so. I think
Right.
COVID was very scary for a lot of patients. A lot of
Right.
people didn't want to leave their house for the most part, and I think at some degree that was a very responsible decision. So I am seeing a lot of patients who are sort of coming back into the fold, having missed their annual exam last year, which is okay for the most part, but it's important to get back to regular standard checkups as quickly as possible.
Well, tell me a little bit about annual GYN visit and why that's important not to skip those patients.
Sure, absolutely. So at your annual visit, it's more like a routine health check where we go
That's
over
true.
all of your previous medical, surgical history. We try and screen for certain symptoms that might be troublesome that you might not even realize there's an issue. The whole point of it is preventative medicine. My mom
Yes.
used to have a saying that an ounce of prevention is worth a pound of cure. And I think it's absolutely true. And so especially at a GYN visit, how it differs from maybe a normal primary care visit is we sort of handle the pap smears, which in my opinion is probably the greatest screening tool that's ever been invented in medicine. It literally reduces cervical cancer tremendously. So as long as you're getting those on a regular basis, you're going to be in pretty good hands and have good care that's going to help prevent some possibly really detrimental problems down the line.
I also see that women are delaying their mammograms, and as well as lots of other tests. Do you have any words of encouragement for women who have been putting off their mammograms, for instance?
Yeah, absolutely. So again, I think it's normal, or it's been a reasonable decision that you might have put it off for a little while, being in the COVID times. However, I think it's time to come back and get the routine
Yearly
screenings done.
mammograms.
Exactly. And everything is set up in such a way that we're trying to maintain a good, safe area to provide care, and we've done a good job, and I think you should come on back.
Well, let's talk a little bit about those safety measures. In your office, in the OBGYN office, what precautions are you taking to make sure that your patients are safe?
Yeah, absolutely. So every patient, when they get seen, they are asked a series of screening questions to make sure that they are not at higher risk for actually having an infection. And if they have potential concerns or symptoms, then we have them rescheduled, or we do things through televisits over the phone. And then the staff themselves, the majority of them have been vaccinated at this point. We also maintain wearing masks and all those other sort of routine strategies to help prevent the spread of COVID virus.
How about the chairs and the way they're set up? Are they separated?
Yes. So they are separated, so everybody's hopefully at least 6 feet apart. The chairs are cleaned along with our regular equipment in our rooms to make sure that if there is some sort of virus there, it is eliminated before the next patient can come into contact
And
with
I
it.
think the chairs have green,
Yes, that's how we identify which chairs are clean and which ones are dirty or which ones need to be cleaned.
because I see green ties everywhere in all the practices.
That was actually one of my first questions when I arrived here.
What are
does
all
the
the-
green mean?
Well, let's talk about scheduling. How about online scheduling? Can you schedule appointments online through MyChart?
Yes, you absolutely can. In fact, it's a very easy process once you're signed up to MyChart. And that's just good in general, simply because MyChart's going to give you access to labs. It's going to give you an easy way to communicate with us and read your result notes and stay more in touch with your own health care. So yes, you can do that through MyChart and come see us that way, but you can also give us a call. Our primary number is 910-720-4050. We'll be happy to take any phone calls you have. Oh, sorry, 721-4050. We're happy to take any calls and schedule you over the phone.
And I don't think you need a referral for an OBGYN, is that correct?
No, we establish a lot of primary care with our patients, so you don't necessarily need to be referred. However, if you have a primary care physician who has an issue that that they would like you to be seen by us for, that can also be another avenue for you to get in touch with us and establish care.
I want to touch on the mammograms for one thing with the COVID vaccine. I understand there are some restrictions or
Yes, I know exactly what you're touching on. So it is something that we have seen where if you have just recently received a vaccine, the vaccine is designed to cause an immune response. And one of the things that happens in an immune response is sometimes your lymph nodes can be a little bit swollen. So when you have a mammogram that picks up on those enlarged lymph nodes, that's technically also a sign that could potentially be an indicator of a possible breast abnormality, such as a breast cancer and that sort of thing. So we are encouraging people to distance themselves from the time they get the vaccine to actually getting the mammogram, just to avoid that sort of false positive and then the stress and the anxiety
well, it
that
scares
comes along with
you,
it.
you know.
Absolutely.
Yeah,
and so it's a
it's-
very easy thing. You just give it a couple of weeks to a month in between, and usually that's enough time for that immune response to resolve.
Okay, so a couple weeks afterward, you should be clear and you
Absolutely.
can go ahead and have your mammogram then.
Absolutely. A couple weeks after your last injection,
Yes,
if you're doing
if
the
you have the
two-part series.
two vaccines.
Yeah.
And are you taking new patients?
I sure am. I think as the youngest member in the physician group right now, I have
You're
the
the
most
baby of
openings.
the group,
I'm the,
right?
I'm the baby of the group, absolutely. I have the most openings, so you'll be able to get seen by me sooner. All you have to do is call and make an appointment or go through MyChart like we mentioned earlier.
Great. Well, thank you so much for being on with us today. It was a pleasure to have you back, and I look forward to having you again in the future.
Anytime, June. I really enjoy these.
Great. Thanks so much.
Absolutely.
Finally, let's welcome Dr. Ted Parcell of Novant Health Orthopedics and Sports Medicine. Dr. Parcell, it's so good to have you back on the show.
Thanks for having me. I appreciate it.
This is the only time I get to see you anymore during this COVID thing.
Yeah, things have changed quite a bit. And
Yeah.
hopefully soon we'll get back to
I
where we want
hope
to be.
so. I hope so. Well, there may be some viewers out there, and this mask is driving me crazy. There may be some viewers out there who haven't had the opportunity to see you or learn more about you. So remind us about your education and your background.
Sure. I'm initially from Pennsylvania, but I've been working down in the Carolinas now for over 12 years. I trained in Pennsylvania and then did my hip and knee replacement fellowship down in Tampa, Florida for a year of extra training in hip and knee replacement. And then I've been here a little over a couple years, almost a couple years now. So.
Yeah. Well, I'm curious, what interested you in orthopedics?
Sure. It goes way back. I'm, like most kids, I was a sports fan, and when you see
Oh,
one of your
yeah.
favorite athletes go down,
Oh,
hurt
yeah.
and lost for the season, it kind of piques your interest as to the
Yeah.
field and how they get them back on for selfish reasons at that time. You want to see your team do well, but and then as it evolved, I initially thought of doing sports, but it became more clear to me that joint replacement was right for me.
Yeah, and there's a lot of it here.
Certainly is.
Tell me a little bit about your office, and I know you have a partner physician, so talk about your office.
Yes, our office is located in Supply, right on 17, just past the electric company. And in the office is myself, my partner, Dr. Ben Browning, and our PA, Devin, seeing patients there most every day of the week. A few other staff there, and we're just a stone's throw from the hospital, so if we need
Yeah,
to
it's
run
close.
over there for
Nice.
any reason.
Yeah,
yes.
close to the hospital for sure.
And easy to find and right on 17.
Yeah. So I know you've done special training in hips and knees, and so I want you to talk about that a little bit.
Sure. My extra training is in hip and knee replacement, from the simple, straightforward, first-time surgery, but also some of the more complex revision surgeries that people have had 2, 3, 4, or more surgeries seen, and try to get it straightened out. I'm also competent in taking care of some of the infections that we'll see around.
Oh, yeah.
And some of the other guys in the area have even called me on some of the fractures that happen around an implant as to
Oh,
fixing
boy,
it.
I bet that's complicated.
It can be and can be time consuming, but I'm happy to do it if it's in the patient's best interest.
Yeah, absolutely.
And what we've also seen now is, especially over the past year, we've seen quite an influx of new residents to the county. And I've had folks who have had their joints replaced in the Northeast or elsewhere through
Right.
the area come just to, hey, I haven't had it checked out in a few years. Let me know what you think. And we've seen more and more of that recently.
Typically, is it an older patient who needs a knee replacement?
Not always. That's the old rule of thumb, old wives' tale sort of thing, that joint replacements were only for elderly people with kind of a limited expectancy. The old thought was, okay, our implants are only going to last 10 or 15 years.
Right.
If you look at the data that's out there, at 15 years and longer, 95% and higher are still doing well. So our implants have improved. They're not wearing out like they used to, so we can get in sooner. So people don't have to suffer and wait year after
yeah,
year
that's
after
what
year. But we can get in and they can get back to life, and especially around here, back to the beach, back playing golf,
Yeah.
and getting outside and being active.
Yeah, because I'd heard a long time ago, I used to hear people say, well, I don't want to get it till I absolutely have to because it'll wear out and I'll have to get a new one.
Yeah, and it's since the implants have evolved, we don't see it as much of a problem now as even back when I was training, we saw much of it, but we don't see it as much now.
So now you get
The
it when you
implants
need
are
it.
better. Yes, so you can go ahead and get in. In my career, the youngest total hip I've done is in her 30s. And I've also replaced people up into their 80s and even a couple into their 90s.
Really?
Yes.
Oh, wow. So tell me about Dr. Browning. Does he have a particular focus area?
Sure. He is a sports medicine orthopedic surgeon, so he
Right.
specializes in taking care of our athletes and doing the arthroscopies of knee and shoulder. And since my training is in hip and knee, I don't do much in the way of shoulder work. It works well to have us both in the same office, that he can
Right.
take care of all the shoulder needs and upper extremity things that are not in my specialty. But we brought him in back in the fall, and he's picked right up. And now that sports are starting to resume and get into the schools, and take care of these athletes now.
Yeah. Yeah, it's certainly been a strange year for all of us, though.
Most definitely.
And in your office, have you seen that people have been putting off their replacements because of COVID?
Quite a bit. Before everything happened a year ago, we were
Right.
seeing patients in the office and getting them ready, and a lot of them sort of vanished. And you see them coming back now. Oh, hey, I was going to, but I was scared. And
Yeah.
now that it's becoming less of the terrifying issue that it was a year ago, that patients are starting to come back out, those that have been vaccinated, and patients are all getting tested preoperatively
That's true.
so that the appropriate precautions can be taken if necessary. And it shouldn't be scary for patients. If they need to seek care, then they should. Waiting around, hurting, and being miserable is no way to
Well,
live.
yeah, you're just delaying getting better now.
Right, and by now, patients could be up and at 'em now as the spring rolls in
Right.
and can be more and more active.
Yeah. Let's talk about some of the measures that your office has put into place to keep patients safe while they're in the waiting area and so on.
Yes. There's a number of things, and a lot of this is across the board for Novant
Right.
facilities, that patients are all being screened on the phone before coming to the office. There's temperature screens at the office. We will limit the traffic in and out of the facility, and patients can bring with them one
person?
one family member, spouse, whomever, so that you don't have large families gathering around. And everything is being cleaned and wiped down between patients, including the waiting room and the door handles and the
Yeah.
scale and everything
Yeah.
from that sort. And the staff's all taking the appropriate precautions and with patients. And
And the
it's been
staff has
fine.
all been vaccinated.
Yes, and everything's gone just fine.
And the hospital, too, they've taken many of those precautions, if not all of them.
Yes.
And as you said, patients are tested prior to,
Yes, my
Surgeries.
joint replacement patients that go to their pre-op appointment just to have their routine labs drawn
Right.
prior to surgery are also being screened for COVID.
so again, you would say, don't delay your orthopedic care. It is time to,
It's time for people to get back out and come seek the care that they need.
okay. Yeah, because like you said, they could be better by now. They could be out playing golf or something.
Right, especially now
Yeah.
that the weather's all starting to change over and
Sure.
it's getting warm out. Yeah, the golf courses are getting busier and busier, and
Sure.
yeah, enjoy your life. That's
Yeah.
why I do this for a living, is to get people back to doing things they want to do instead of sitting around and being frustrated
And
with-
hurting.
Right, right.
Yeah,
I want to
yeah.
get people back to life
Yeah.
and doing things.
Are both you and Dr. Browning accepting new patients at this time?
Most definitely, most definitely. In our office, whoever answers the phone will get you in as soon as we can, and we'd be happy to see any and everyone.
And do you need a referral?
Depending on the insurance, you may, but a lot of insurances now you can call directly.
Correct.
Which
And your office could probably tell them that when they called
exactly,
in.
yeah. The girls answering the phone are highly knowledgeable and can take
Okay.
care of those
Well, that sounds
questions.
great.
Yes.
Great. Do you offer video visits?
We do. We've used them sparingly, and what
Okay.
we do for a living, getting people in
Yeah, it's
and
kinda
actually,
hard.
it's difficult
Yeah.
to get people actually in and image to get their X-rays, so we can actually see what they need,
Mm.
and then getting an examination to really get down to the meat of it. Some of that is very difficult to do
Mm-hmm.
remotely,
Yeah. Okay.
but we have the capability when necessary.
Okay. That sounds great. Well, thank you again for coming today. It's been a pleasure to have you, and I look forward to talking to you soon.
Thanks. A pleasure as always. Thanks again for having me.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.